Now let's move on away from igloo to pesticide or herbicide, in this case glyphosate. And you see this is published in the review paper journal from the Journal of Immunotoxicology. And so you can see here glyphosate in the center, in the hub, and you can see the arrows pointing away, so you can see glyphosate's effects, right? There are cytotoxic effects, oxidative effects, there are cancer-causing effects or carcinogenic effects. There have been a lot of lawsuits recently cited in favor of the plaintiffs against the producers of glyphosate as a reason for causing these plaintiffs cancers. So there have been a tremendous amount of lawsuits recently settled in that regard in favor of the plaintiffs, in other words, against glyphosate as a cause of cancer. We know that it has reproductive effects and teratogenicity effects, meaning it can cause birth defects. Cardiovascular effects, such as anemia and heart arrhythmia. We know it can cause cerebral effects, depression and anxiety and memory and locomotion problems. Digestive effects on the microbiota, on the liver, and on our ability to energize or produce energy through metabolism. So glyphosate's a bad deal. If you look here, in this published paper out of Journal of Organic Systems, glyphosate disrupts the endocrine system and the balance of gut bacteria. It damages DNA and is a driver of mutations that lead to cancer. And this, my friends, is why it's important to buy organic. It's so important to buy organic. So many of you will say, you know, I can't afford it, or it's just too expensive, or I don't feel bad, so I can't justify the cost. Look, cancer doesn't happen overnight. You don't wake up one day and all of a sudden you develop cancer. Cancer is about chronic decision making. If you make bad decisions over many, many years of time, you increase your risk for the development of cancer. There's not one cause. Glyphosate certainly a contributing factor here, but this is why we want to choose foods without pesticides, herbicides. Grow your own, join a local co-op, buy organic from your grocer. The organic from the grocer is not perfect, but it's far better than conventional GMO-based foods. Something else I think it's important that you understand about glyphosate. If you look at this diagram, dopamine and serotonin are made in your gut. About 90% of serotonin is made by the gut, not by your brain. And about 50 to 60% of your dopamine is made by your gut, not by your brain. Now that being the case, one of the things we know about glyphosate, look at this diagram over here on the right, is that it interferes with a very important biological pathway in your body called the shikimate pathway. And if you look at downstream from glyphosate, so look at the upper right-hand corner of that diagram, you see glyphosate there. But as you follow that graph downstream, you get down to tryptophan, which is a precursor to producing serotonin and melatonin. And if you follow it through the center, you'll see that tyrosine in the middle, and you'll see the tyrosine is a precursor for dopamine, as we're discussing here. But it's also a precursor for epinephrine and norepinephrine and thyroid hormone. So again, how many of you are struggling with thyroid illness or thyroid issues but refuse to eat organic? It's very, very important that you understand that this one chemical additive that's sprayed on the grains, that's sprayed in the food, has the ability to cause so much damage. This is just showing you one more mechanism of that potential damage. Now look here, you can see that glyphosate causes reduced nutrients in plants as well. Now, again, another reason why it's important to buy organic. Look at this list of nutrients that are depleted in plants. So that means when you eat the plant, you're trying to get nutrients from the plant. But if the plant can't get access to nutrients from the soil because it's being sprayed with glyphosate, now what you're eating becomes less nutritionally dense. So look at this here. Calcium, potassium, magnesium, zinc, copper, boron, iron, manganese, sulfur, and phosphorus are all lower in plants being treated or sprayed with glyphosate. Okay, switching gears away from glyphosate into mycotoxins. Again, if you notice the trend in all this that we've talked about, these are all things found in grain, and this is why I'm of the opinion that the number one thing you can do to overcome leaky gut is get grain out of your diet, because it comes with not just gluten, but all these other things. Here's one more, mycotoxins. You can see upon ingestion of contaminated food or feed, the GI tract is particularly affected by mycotoxin. Generally, intestinal barrier in the GI tract functions as a filter against harmful mycotoxins. However, some mycotoxins have been found to exert their detrimental effects in the GI tract. For example, mycotoxins can alter the normal intestinal functions such as barrier function and nutrient absorption. Some mycotoxins also affect the histomorphology of the intestine. Go to the right, you can see a review study. There's an increasing awareness of the deleterious effects attributed to mycotoxins during their fate within the gut. Evidence indicates that disruption of the epithelial barrier is well established. So mold, mycotoxins, common contaminant found in grain-based foods. Okay, switching gears now. In this review paper published in Microorganisms, you see here we aimed at describing how environmental pollutants, heavy metals, pesticides, and other persistent organic pollutants and food additives might interact with mucus and mucus-related microbial species, that is, mucophilic bacteria, such as mucus degraders, bacteria that will help break down mucus. This review highlights that intestinal mucus, either directly or through its crosstalk with the gut microbiota, is a key yet underestimated gut player that must be considered for better risk assessment and management of environmental pollution. In other words, the more you can avoid the pollution, the more you can avoid the potential for breakdown in your gut. Now, let's look at medicines for a minute, because leaky gut, as I mentioned earlier, leaky gut causes systemic inflammation. Systemic inflammation multiplied over time equals repair deficit. Repair deficit multiplied over time equals disease states, right? Particularly autoimmune diseases. Now let's look at what doctors do to treat autoimmune disease. They write prescription drugs. That is the typical answer, pretty much hands down, for most doctors treating patients with autoimmune disease. It certainly was the case when I was in the VA hospital in the rheumatology wing. Everybody got drugs, nobody got diet guidance or lifestyle advice. So here are the top 6 prescription drugs dispensed. They are for pain, cholesterol, blood pressure, hypothyroid, acid reflux, and antibiotics. Now, let's look at how some of these classes of medications can affect your gut. We just spent the better half of an hour discussing how grain-based foods and the contents within them can damage your gut, and how that can lead to systemic inflammation causing disease. Now we're getting into medicines, because medicines are what doctors use to treat disease. So now we're going to get into how medicines can actually destroy your gut as well. So you can see this. You're stuck in a trap. If your gut's damaged and you're using all these drugs, you're not going to get out of that trap. So let's dive into antibiotics. You can see here antibiotics alter gut microbiota. Look at this diagram. You can see loss of potential competitors, so you knock out good bacteria. It lowers the expression of antibacterial proteins like IgG, which is an antibody, and it decreases neutrophil-mediated killing. So it weakens the immune system, making you more susceptible to overgrowth of other problems. It disrupts T regulatory and TH balance, elevated inflammatory tone. So again, it changes the nature of the immune system, leading to an increased development or risk of atopic diseases, as well as inflammatory and autoimmune diseases. Look to the right, you can see the establishment of resistant bacteria. When you take antibiotics repetitively, or you're exposed to antibiotics repetitively, makes it easier for antibiotic-resistant bacteria, and sometimes they're not the best kinds, not the ones we want growing in us, makes them easy for them to become established in our guts. They can also transfer their resistance. The antibiotic-resistant genes can be transferred by the bacteria. So, when you take multiple antibiotics and develop antibiotic-resistant strains, they can share that gene with other bacteria in you, making you more susceptible to future infection and not having the capacity to accurately treat it. I bring that up because so many doctors prescribe antibiotics just in case you're coming down with something, or you go to the dentist and just in case we're going to put you on this antibiotic when we clean your teeth. Don't take antibiotics unless you absolutely need to. You can also see the elevated inflammatory tone and the altered insulin sensitivity, as well as the altered metabolism of short-chain fatty acids and bile acids. Why does that matter? Short-chain fatty acids are the primary fuel source for your colon cells. It's how your colon cells make new cells and keep your colon lining intact. And when you take antibiotics, you damage the bacteria that help you make short-chain fatty acids. So then your colon starves of energy, and the cells in the colon can't function as well. You can see the linkages to obesity, metabolic syndrome, and diabetes as well. So antibiotics create a lot of potential downstream problems, especially when overutilized. Okay, let's go into this next diagram. I want to focus in on the right-hand side of this diagram. You see medications that contribute to leaky gut. You see there non-steroidal anti-inflammatory drugs. These are drugs like ibuprofen and aspirin. You know, how many of you have had a cardiologist recommend that you take aspirin every day? Well, these drugs erode the mucosal lining of your gut, and they can cause an erosion and a leakiness of the gut. Birth control pills, antibiotics, immunosuppressants, corticosteroids, antacids all contribute to leaky gut. Some of the most commonly prescribed drugs out there. You see under the center there, NSAIDs and leaky gut, direct damage to mucosal lining of the stomach and the small intestine. Metabolites from the liver break down to oxidize gut cells. These medicines can also deplete you of vitamin C and iron, also folate. Leaky gut and birth control pills. We know that birth control pills can deplete vitamin B6 and magnesium and B12 and vitamin C and folate and vitamin E and calcium. But we're also now seeing research that shows that these exogenous estrogen hormones can contribute to leakage of the gut barrier. Okay, look at these studies here. Effects of steroids upon the GI tract. In the stomach, high doses of glucocorticoids inhibit prostaglandin biosynthesis, thereby inhibiting the gastric alkaline response and producing severe gastric lesions. Exacerbation of subclinical intestinal infections and perforative lesions have been observed in both animals and man given glucocorticoids. In other words, the longer you're on them, the more potential damage they can do to your GI tract. Now go over to this study on the right. It's a review paper published in Gastroenterology. The pathogenesis of non-steroidal anti-inflammatory drug NSAIDs induce small bowel disease suggests that increased intestinal permeability is the central mechanism that translates biochemical damage to tissue damage. Increased intestinal permeability appears to be a central mechanism in the pathogenesis of NSAID enteropathy. So again, leaky gut. This next review study. The risk of upper GI complications associated with NSAIDs, glucocorticoids, acetaminophen, and combinations of these agents. So they took all the primary anti-inflammatory drugs and in their combinations, and here there's a review explaining kind of what to understand. So most anti-inflammatory drugs have been associated with increased risk of serious upper GI complications. The risk of GI tract bleeding or perforation increases twofold with use of oral steroid or low-dose aspirin, and increased around fourfold with use of non-aspirin NSAIDs. That would be drugs like ibuprofen and naproxen. They go on to say acetaminophen at daily doses of 2,000 milligrams and higher has also been associated with an increased risk. Overall, the risk is dose-dependent and is greater with more than one inflammatory drug taken simultaneously, so don't mix your medicines. Hence, whenever possible, anti-inflammatory drugs should be given in monotherapy and at the lowest effective dose in order to reduce the risk of serious upper GI complications. Here's moving into some more medication. So this one on the safety, tolerability, and risks associated with newer generation antidepressant drugs. How many of you are taking SSRIs? You see here several effects are transient and may disappear after a few weeks following treatment initiation, but potentially serious adverse events may persist or ensue later. They encompass gastrointestinal symptoms such as nausea, diarrhea, gastric bleeding, dyspepsia, hepatotoxicity or liver toxicity, as well as weight gain and metabolic abnormalities. You can see here Oral Contraceptives and Menopausal Hormone Therapy, Current Evidence and Future Directions. It's a review paper published in the journal Drug Safety. You see here, first, oral estrogen has been shown to modify intestinal permeability. Recent data have linked modification in the gut microbiome to endogenous levels of androgens, which are also known to be altered with exogenous hormone use and influence the development of autoimmune diseases. Oral contraceptives are also associated with an increase in certain Candida and Prevotella species in oral flora, a resultant increase in risk of periodontitis or gum disease. In addition, recent animal data suggests that gut commensal microbes may modulate levels of endogenous testosterone. So this leading to the potential development of autoimmune disease. So birth control pills or estrogen therapies can modify gut permeability while simultaneously increasing Candida overgrowth, the potential for it, or the potential overgrowth of Prevotella. So not a good thing. Remember, Candida overgrowth can also cause leaky gut, and Candida can mimic gluten. So if you're gluten sensitive and you have Candida overgrowth, Candida produces a protein that mimics gluten, and so even if your diet's gluten-free, that Candida overgrowth can mimic gluten exposure. Now here's another study on antidepressants. You see nearly 13% of Americans 12 years and older take an antidepressant. That should scare the hell out of all of us. These drugs carry risk for gastrointestinal and intracranial bleeding that compound when taken with other medications. The most common and concerning interactions occur with non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen, as well as agents that anticoagulants like warfarin, Coumadin, or antiplatelet medicines such as aspirin and clopidogrel or Plavix. Okay. Here is a diagram with some of the more common drugs that impact gastrointestinal function that can lead to, contribute to leaky gut. And so I'll hold this diagram up on the screen for you. Common drugs, you can see here antibiotics, pain relievers. I've just shown you a number of research studies. I've shown you a number of research studies on antidepressants, as well as acid reflux medications. And you can see the mechanisms here. Antibiotics destroy healthy gut bacteria, hinder digestion and vitamin synthesis, contribute to an increased risk of infection, contribute to leaky gut, and the development further of autoimmune disease. You see pain relievers erode the mucosal lining in the stomach and upper small intestine. You see acid reflux medications inhibit or lower stomach acid function, which hinders digestion of nutrients like protein, calcium, and vitamin B12, which leads to weakened immunity, depression, and bone loss. You can see antidepressants alter gut motility and contribute to constipation, but also I've shown you that they cause intestinal permeability as well. So we look at other medicines and how they interfere with gut function. You know, the GI tract is super important in its ability, again, to act as a quarantine zone, but also to extrapolate the nutrition from your food. So anytime you're taking drugs that can interfere with its functionality, you're running the risk of exacerbating your pre-existing illness that you're trying to treat with the very medications. And so, again, keep that in mind. This is especially true for those of you who are taking multiple medications. So if you go through this list, I'm not going to read it to you, but you can see there's a laundry list. So pause this section of the video, take a snapshot of it and read through it and make sure if you're taking drugs that are interfering with your capacity to digest, you're most likely making the problem worse in many ways. Now, a special note about blood pressure medication, especially as it relates to gut damage. Those of you that are taking a class of medications that end in an ARTAN, so drugs like olmesartan and valsartan, these are drugs called angiotensin receptor blockers. And there are a number of new studies now coming out showing that these drugs that are used to lower blood pressure can actually damage your villi in your intestines. In other words, they're mimicking celiac disease. They're causing the same types of damage that we would see gluten cause in someone's gut. So you can see olmesartan is a prescription medication used to treat high blood pressure. New study finds that the side effects of this drug can induce symptoms that mimic celiac disease. This was published in Mayo Clinic Proceedings. This was also a study, a quotation by Dr. Murray. We thought these cases were celiac disease initially because their biopsies showed features very like celiac disease, such as inflammation. We made them different. What made them different, rather, was they didn't have the antibodies in their blood that are typical for celiac disease. So be aware, if you're taking this class of medication, know that it can cause celiac-like damage and, you know, all the symptoms and everything else that comes with that. And don't forget, you know, we're talking about a lot of medications here, but caffeine is also a drug. It's just not typically classified as a drug. So a couple of notes on caffeine. For those of you who drink lots of energy drinks or take extra caffeine in your supplements or overconsume coffee or other caffeinated beverages. You see here, our results indicate that coffee may damage gastrointestinal mucosa in habitual coffee drinkers. Now, side note, I'm not trying to take away your coffee. It's my experience clinically, reasonable amount of coffee for most people. Most people can get away with a cup a day. The ones that I really see struggle are the ones that are drinking multiple cups a day. They're sipping on coffee throughout their day. They're not drinking water. They're drinking 3, 4, 5, 6 cups, a pot of coffee over the course of their day. So if you're one of those individuals, take heed. You see this next study here. It's demonstrated that coffee promotes gastroesophageal reflux. Again, the higher the doses, the greater the risk. And that's what you want. That's the way you want to think about it.